part of the daily job was to recount the number of deaths. And I think I would get choked up almost every time just thinking about, gosh, like, isn't there something we could have done to not have all these people perish, despite all of the tireless efforts? It was a heavy weight to carry. Oh, yeah.
It's okay.
I can't imagine that I don't know when this will stop, when I can talk. I mean, I don't know when would this.
And for those of us who aren't aware of what you've been up to, we saw you on TV every day, it felt like. What are you doing now? What is life like for you now?
So I am so proud to serve as the president and CEO of Sinai Chicago. It's Illinois' largest private safety net health system. So it's a 3-hospital system along with a community services arm and a research arm. That is a major training ground for thousands of future healthcare professionals. It's an honor to serve there. It's really an extension of the work and taking care of some of Chicago's most underserved and vulnerable communities, and trying to give them the important gift of healthcare and treating them with cultural competency and respect and helping them live their very best lives.
I think this thing, my wife is in healthcare, and there's something about people that enter that field that you want to help people, you want to care for people, and essentially you're getting to do the same thing now, just in a different role. Is that right?
No, absolutely. I feel, once upon a time I maybe represented the whole state of Illinois and 12.5 million people, but to be able to kind of get local and focus on a smaller community of 1.5 million is about the service area that we extend to, and really focus on many of the same things. This really is the same things. It's, focusing on health, public health, access to care, preventive medicine, treatments. It's really an honor to be able to serve in this capacity. I'm so grateful. The work is very hard. People think, oh, nothing could be hard after COVID. Well, I think healthcare in this day and age is pretty challenging. And if you're taking care of people with less resources, it's a little more challenging, even though it's just as critical and just as important. I would say more important, because I have the honor of trying to take care of some of the communities that already have some of the worst health outcomes. And so it's a little bit of a catch-22, that to take care of people who are already further behind the starting line and to have less resources to do it seems a little backwards. And so we're trying to figure out how we can make this make sense and make sure everyone in the city of Chicago, not certain neighborhoods, but everyone in the city of Chicago can have the access they need to live their best life.
And I think that, you're super qualified for the position that you're doing now. I'm curious, from your position with the IDPH, what prepared you the most? I mean, of course, COVID was such a big part of that, but was there something about that prior role that helped prepare you for what you're doing now?
I think leadership is leadership. People say, like, you can get up there and say whatever you want, and you can say, you're the leader, but if nobody goes with you, if nobody's following you, you're not really achieving much. And so being able to help people get behind a mission, get behind the important work, and get everybody enthused to actually take on the hard stuff, guess I've done that. And there's more of that where Sinai is, because taking care of the least among us, being short of the resources that are needed because of our system of giving less money to people who are on Medicaid, it sets up for a real challenge. I often say the math ain't mathin', and so it makes us have to get very creative in the ways that we can, at the end of the day, get to the right outcomes, which is helping everyone live the fullest, live to their fullest potential.
There are so many challenges in healthcare and in public health right now. just in the 5 years since the COVID pandemic, which seemed to dominate everything in that span of time, I'm just curious, how often do you think about the pandemic now, 5 years later?
I mean, we're trying to not think about it as much, but the truth is, the pandemic has had long-lasting, lingering effects, right? So some of the challenges that I'm facing today in trying to lead this incredible system whose mission is to take care of everyone regardless of their ability to pay, some of the challenges I'm facing are still remnants of, some of the costs that were incurred from having to pay the traveling nurses and the extreme rise in products and the supply chain costs. Those challenges I'm still dealing with, right? And not to mention the fact that the actual virus itself made the health of many people worse. I mean, obviously we know the large number of people that lost their lives that are not even here, but people are still dealing with many after effects of the illness. Families who lost somebody from the illness have struggled to get their family on their feet, maybe their primary caregiver or some other, critical financial caregiver was lost, and so what that has done to the family. So there are so many after effects that are still affecting us today, even though, I have probably less than, a dozen or two people in the hospital with COVID. We really haven't seen a lot of the actual virus in recent months. I think we had a little bit of a mini surge at the end of the summer in August, but since then the numbers, have been low. We have a lot more flu. My daughter was just diagnosed with the flu today.
Sure.
But the effects are definitely long lasting, and we will continue to feel the ripple effects of COVID for, unfortunately, generations to come.
This was such a pivotal moment. I mean, I think everyone can remember those scary few days 5 years ago today. Do you remember what those days were like?
There were so many days, right? And I know we think of it in March. I know, it was probably tied for most people to when kind of the world began to shut down. But I mean, in January, January is when we had our first case in Illinois. And so actually those daily press conferences began, much earlier when we had our first case and then our second case, because we had literally the second case in the country. So it was right on our doorstep. And so the franticness and like all the busyness started in January for everybody in public health and many people in the healthcare sector, even before kind of everybody felt it, just by the, some of the, stay in place, stay at home, orders.
I can imagine it was just such a frenetic pace in those early days, from January to February to March. Have you been able to fully digest and process all that happened in those early days? I journal, so there are things, that are recorded. But a lot of it is, even reading things back, sometimes it's like, oh, okay, I can't take much more, because all of these feelings well back up. It was just a lot, but I keep trying to focus on the positive sides of it, and just thinking about how incredibly strong the teamwork was, and how people, government workers, the idea that government can't be fast or nimble, like we shattered all of those stereotypes and just did Herculean things to really lead the state and kind of lead the nation in terms of, some of the successes we had in terms of the mortality rate not being as high as many other places, and having higher rates of vaccination, which actually was very protective in helping us to move forward. Yeah. You're leading the state through this pandemic, but you're also navigating this as as a mom, as a spouse, as a family member, as a churchgoer. I mean, that's a lot trying to balance it all at the same time.
Yeah, it's a lot. It's a lot. I try to rest on different verses and adages, but to whom much is given, much is expected. And so I feel like I've been imbued with a lot of talents, and if this is the calling to use them to help, I'm honored to be able to do that.
I'm curious, because I remember there were protests outside of your home. There were a lot of people that were upset about the lockdowns and the restrictions. It was a very emotional moment as well for a lot of people. I'm curious, out of all that, what was the hardest part of leading the state through the pandemic?
I think it was always feeling like, am I doing enough? Part of the daily job was to recount the number of deaths. And I think I would get choked up almost every time just thinking about, gosh, like, isn't there something we could have done to not have all these people perish, despite all of the tireless efforts? It was a heavy weight to carry. Oh, yeah.
It's okay.
Mm.
Yeah, I don't know if we have. You're being human. I mean, you're trying to. You've got a tough job to do, but at the same time, process and digest this, and every single day delivering those updates. It's got to be tough.
Yeah. No, Yeah. It was tough. I think there was a day. I know there was a day where I didn't hold it together as well, and I was mortified. I was mortified, and I was embarrassed for myself, and I felt like I had, let my boss down, let the governor down, and I couldn't get off the podium into the green room fast enough, and I remember just apologizing profusely to the governor because I was so embarrassed, and he was like, "You don't have to apologize for being human," and that was so affirming to me. And I remember, and I still have every one of them. I got almost 1,000 cards and letters from people saying that they were right there with me, that my tears were their tears, and they appreciated understanding that this really meant something to me and that it wasn't a job. And so it gave me a different outlook to, sorry.
Okay.
Jesus, help me. I can't imagine that I don't know when this will stop, when I can talk. I mean, I don't know. When would this?
I don't think any of us know. I mean, that's the thing. It's still, I hear 5 years, and I know there's some days I remember like they were yesterday.
Yeah. I've come to embrace that being my authentic self, which means having feelings and not always being able to push them down is not, it's not the worst thing. It's not the worst thing. And I think, being able to show humanity, not the worst thing. I think probably need a little bit more of that.
Absolutely. That's one of the big takeaways for this. We're all in this together.
We are all in this together.
We can all stay safe.
Yeah.
You kind of touched on this, but I'm curious, what are you most proud of
Oh, gosh.
during the response to the pandemic?
I am really proud of how, and it's not just IDPH, but it was the other 97 local health departments. Some of them have a total of 5 employees, all of us working together, trying to shore up and protect our state. There's never really been something like that, that just made us all working just hand in hand in lockstep. We had meetings with all of us multiple times a week, and we had leaders in different parts of the state that were facing tremendous headwinds, and they were trying to push off the disinformation, the misinformation, and trying to do the right thing. Some of our strongest leaders in the health department, decades of serving in that role, many of them lost their jobs in doing this important work, but it didn't stop them from going out, doing the right thing. I mean, there was just so much heroism at all levels of people that most people will never know, but I saw those people, I worked with them. I'm honored to have served, literally like served with them. Yeah. And so I hope that we continue to have an influx of public health leaders that will stay true to the facts and be able to lead us through whatever next challenge, pandemic, whatever will come to us next.
That's why I'm curious. I mean, the new administration in the White House has picked some leaders that have been very outspoken against vaccines, outspoken against some of the protocols that went into place during the COVID emergency. President Trump's pick for HHS, RFK Jr., has been a vaccine skeptic, and the NIH secretary also critical of some of those stay-home orders. Where do you see public health moving in this country compared to where it was before?
Yeah. Well, public health undergirds any, good public health undergirds any stable, prosperous society. You have to have, clean water. You have to have vaccinated people against illnesses that can now begin to decimate populations again. We have to, I don't want to use some of these cliches, but the truth is, we have to understand science, we have to understand data, and we're supposed to build on it so that we can be better than we were before. And so, things like vaccines and not appreciating that that's one of modern technology's greatest inventions. If we move away from that, and we're seeing outbreaks, like massive outbreaks of measles, in certain parts of our country, and if we're dealing with facts, it's in unvaccinated individuals. So we really have to be able to look at where we've been and where we are and understand what pieces got us there and try to build on that instead of going backwards.
So what is your take on the president's picks? It seems like it's a complete opposite. What is your take on that?
Elections have consequences, and what's the phrase? To the victor goes the spoils. And so when we elect a leader, then we allow that leader to make their choices, and they make the choices that will further their agenda. And so we have spoken with our votes, and we have elected our leader. And so now that agenda will be carried out. I think we're trying to figure out, as we see what's going on, we'll figure out exactly what that is. But I think we all understand that healthcare is very important. You cannot have a thriving community, state, nation if you don't have healthy people. And so trying to prevent disease is just a foundational concept of public health, that if it's not heeded, we're going to struggle going forward. We'll have a populace that is less healthy, more sickly, which I think it's hard to be a good student if you're not healthy. It's hard to be a good worker if you're not healthy. So I think we can all agree that health is wealth. Health is very important. And so I am going to trust in our leaders to make health a priority and ensure that we are taking steps to make us, the healthiest community and nation that we can be.
In terms of staying healthy and in terms of just everything that we experienced 5 years ago, I know for one, I don't want to have to go through that ever again. How worried are you about another pandemic in the United States or another global pandemic?
The experts, and I fully admit that I'm not keeping up with everything the way I was, but the experts are saying that it's not a matter of if, but when. And so it behooves us to, fortify all of our infrastructure and make sure that we're reading those after action reports from the COVID pandemic to realize what we need to do to be ready for the next one. And so that involves not just public health leaders, that involves healthcare organizations, that involves the community. We saw that it was an all-in effort where everyone had a role to play. And so, we do need our healthcare and public health leaders to definitely be ensuring that those anchors and that infrastructure is in place, because unfortunately we think something will occur. We don't know the time or the place. But one thing we know for sure is who will be hardest hit and which communities are the most vulnerable. And so our job should be today shoring up those vulnerable communities so that they aren't so hard hit when disaster strikes. And so that is focusing on chronic disease and trying to help prevent chronic disease or controlling chronic disease. It involves being able to have vaccines to prevent the illnesses that we know we can prevent. It involves screening for diseases and cancers that can be treated if caught in the early stages. And so having access to screening, having access to vaccines, having access to primary care to control and prevent chronic disease, that's just a hopefully non-controversial step that everyone is working towards to make sure that we have the healthiest population that we can going into whatever it is that we may be going into.
Thinking ahead, planning ahead, considering everything that we went through, we know the ripple effects from COVID-19. So yeah, let's start thinking about it now and fortifying and preparing, it sounds like. Yeah. I'm curious, I'm trying to, what are my other questions? I'm trying to think, 5 years later, how do you imagine everyone who's experienced this in the state of Illinois, what do you want them to take away from that experience? I know this is kind of a hard question, but I guess the idea of when other people are going to watch this and they look back at the way the state reacted, the state moved to try to protect people, telling people to stay at home, telling people to get vaccines. What's the key takeaway that you want people to remember from that time?
I think if you want to extract some really clear big wins, it's not necessarily just things that happened in the state of Illinois. There are some incredible things that just happened in the state of Illinois. We were the first public health department in the country to be able to have our own testing capability, which means we didn't have to send it off to the CDC and wait weeks. We were able to just act so nimbly to be able to have, testing stations and vaccine sites all over the state, really thinking about communities that were the most vulnerable and trying to really make sure that those communities had access, understanding that they were the communities that were going to be the hardest hit. Nationally, the amazing scientists that were able to galvanize that mRNA technology and get us a vaccine before the end of the year, like mid-December, when we were vaccinating the very first people in the state, like that was the happiest day of the pandemic thus far. And being able to know that we didn't have enough doses, but we were gonna, get as many people vaccinated as possible and just continue waiting for more shipments. That was such an incredible experience. And so
there were a lot of wins along the way.
Yeah, for sure.
It wasn't just all doom and gloom.
No, the idea of people really working together, looking out for their neighbors, people looking out for one another in terms of, keeping 6 feet, because we thought like if you keep away, then, we don't want to, we're looking out for each other. We didn't want other people to get sick. Like there were people supporting healthcare workers in very tangible ways. I remember before I had the suspicious packages being dropped off, I had gifts of food and flowers, and like there were a lot of beautiful moments. There were a lot of beautiful moments. There was a lot of teamwork. There was a lot of different groups working together that maybe hadn't worked together. There were different faith groups working together, whether it's rabbis or imams, pastors, priests, working together to give messages of telling people, encouraging people to stay safe. There were a lot of great things, and I think it's super important to focus on those great things. Nothing is ever going to be 100% perfect, but there was a lot of, beauty that came up out of the ashes, silver linings, if you will, rainbows.
Yeah, absolutely.
Yeah.
I know, it's good to focus on this. I mean, I was in New York, I was telling you, and there was something special at 7 o'clock when people were banging their pots and pans out the window.
That's wild.
And, celebrating first line responders.
That's wild.
That was really special.
Yeah.
My last question, is there anything that you miss about your job leading the Illinois Department of Public Health? What stands out as something that you miss from that job or that you look back fondly on?
Every job that I've had has taught me so much, has exposed me to some incredible people, frontline people, leaders, and that was definitely the case at IDPH. I really felt grateful for that opportunity. I was probably an unlikely pick. I didn't have really connections, but really got a chance to work with some of the best people in state government, as well as our partners at the local government. And because of COVID, got to work all through state government and through the healthcare leaders and business leaders. Like it really was I look back, even as painful as COVID was, I would never say like, I wish I wasn't in that role. I'm grateful for every day, the good days and the bad days, the tough ones and the joyous ones. I really got to lead some of the greatest people at the Illinois Department of Public Health.
Do you keep in touch with everyone that you experienced that with? The governor, anybody?
I mean, I definitely, have my circle from IDPH that we still talk regularly. I mean, a lot of those people have become family. People, my bosses in the Health and Human Services, a lot of great relationships that have been sustained, and the paths still intersect very regularly because I'm still in the healthcare space, so nobody's gotten rid of me.
It's, I mean, almost like battle buddies. I mean, I
Yeah,
think of
right.
everyone that you work with this
Yeah,
time.
no, it's true.
There's a kinship
That's right.
that
That's
comes
well
from
said.
that.
That's well said. Definitely.
Yeah.
Yeah.
So where do you go from here? I know you've got this new role at Sinai. What does the future look like for you?
Yeah. You know, the future is finding a sustainable path for organizations, safety nets like Sinai that are doing God's work, taking care of everyone, but finding a sustainable path so that we can do this really laudable work and be able to get recompensed, reimbursed, so that we can continue to do more for communities that need it. Right now, even with all that we learned from the pandemic in terms of which communities are the most vulnerable, and understanding how important it is to care for these communities and help their health be optimized. I don't see that always happening in terms of how we reimburse for care for people who are more underserved, who have, whether they're Medicaid or not insured at all. We can do better to serve all people. And I think we are on the precipice of a very special moment where we have to define who we are in terms of how we care for the least of us, how we really believe that healthcare is a right and not a privilege, and how we see, let's say, the city of Chicago in terms of knowing that a prosperous city is only as prosperous as your sickest citizens. And so we have to step up and figure out how we're going to take care of everybody and not just the chosen few.
Yeah.
Successful societies take care of one another. And so even though there are a lot of ideas of how important rugged individualism is for an entire society to be uplifted, whether it's a city, a state, a country, we really do need a spirit of collectivism and thinking about what other people's needs are. That was something that was required in the pandemic, people to think about what they could do to help protect someone else. And maybe it's somebody else that you don't even know beyond your family. When you think about, oh, I'm sick, I need to, isolate so that I don't spread it to whomever I'm running into on the bus, at work. That's something that needs to continue. And so thinking about how we will lift all communities, because we are fortunate to be in what's called a world-class city here in Chicago. We need that to be the case for everyone in the city.
I keep going by that. We're all in this together.
Yeah.
I mean,
Yeah.
how quickly we've forgotten that,
Yeah.
but it's still important today as it was
Yeah.
5 years ago.
5 years ago.